Hello, everybody. My name is Scarlett Henning, and I will be telling you about sex addictions, the culture, the treatment, and the stigma. So, what is a sex addiction? A sexual addiction, according to the Cleveland Clinic, is an intense focus on sexual fantasies, urges, or activities that can't be controlled and cause distress or harm for your health, relationships, career, or other aspects of your life. A sexual addiction is considered a mental health disorder, and a person usually develops them for similar reasons to the person that develops an SUD. Sexual addiction is one of the fastest growing addictions in the world, which is why it's incredibly important to address it. So the history of sexual addiction is that the term wasn't really a thing until around the 1980s. However, sex addictions and problems with compulsive sexual behavior have existed for all of human history. Specifically, looking with the Greeks, we see a lot of evidence of that in their society. The rise of sexual addiction in recent years is not merely being accounted for by the higher rate of diagnoses, as obviously it's only been since the 1980s that we've had such a term and diagnosis, but also is very heavily influenced by the rise of pornography in the internet and the ease of access people have to pornography via the internet. So what is the prevalence of sexual addictions in the modern society? So some studies suggest that addiction impacts between 3 to 6% of adults. Sometimes people will say it's 10%. Various studies have said different things. I went with the more conservative number, but it likely is more. So that's between 10 to 20 million people overall who we are looking at with potential sex addictions. These statistics are also very likely flawed, as there is a huge underreporting problem when it comes to this particular addiction. Sexual addictions are also more prevalent in men than women. However, women are much less likely to report this addiction than men, specifically due to the stigma society has around women with a sex addiction. Not that there isn't one for men, it's just a different type of stigma that causes women to report less. So people who are in non-heterosexual relationships, which means not a man and a woman in a relationship, have higher rates of compulsive sexual behavior compared to the general population. And this is especially true of men who are in same-sex relationships. The statistic is way higher than in the general population of men. Now, compared with the general population, those with sexual addiction also report much higher rates of sexual abuse or abuse of various types, so emotional, physical, and neglect in their childhood. For most individuals, sex addiction also begins around 18 years of age, but most will not seek treatment until around the age of 37. So that's about a 20-year window of time where we are having a ton of individuals who are not seeking help for their addiction and are living in this state of hopelessness. So, what are the psychological effects of sexual addiction? So, the effects of a sexual addiction are going to vary greatly between gender and individual, but the main unifying factor with a sex addiction is the preoccupation with sex that grows out of control for an individual. And that kind of precipitates all the different effects that we see. So, some of the major short term psychological effects that we see are low self esteem, loneliness, self isolation, conflict between ethical values and behavior, anxiety, depression, lack of healthy relationships with partners, friends, and family, trouble concentrating on work or school, developing a porn addiction. So basically, to break that down, we have a lot of people who are being very distracted from relationships and being very disconnected from relationships. People who are having these ethical values that they're not following because of the addiction, which just leads to more shame, more low self-esteem, more loneliness, more self-isolation. It's a self-compounding thing within the short-term effects that we see. Now, some of the long-term effects can include intense anxiety and panic attacks, severe depression, feeling hopeless, developing substance abuse disorders. Sometimes, as we talked about in our textbook, there is a lot of self-medication theories when it comes to SUDs, and sex addiction can be one of the underlying things that people are trying to self-medicate for, not necessarily to stop, but in order to quell some of the poor psychological effects that you're having from these. Um, so some of the other things are extreme shame and remorse, false beliefs, self-hatred, fear of abandonment, distorted thinking, developing paraphilia, which is abnormal sexual desires like exhibitionism, voyeurism, sadomasochism, I did not say that correctly, but or pedophilia, self-harm, and suicidal ideation. So very serious psychological effects we see from this addiction. So some other physical effects of sexual addiction, also, like I said, they vary as the same as how psychological ones do. But some of the major short-term effects we see are sexually transmitted diseases due to unprotected sex, exposure to HIV and hepatitis B and C, injury to genitalia due to excessive sex, losing employment or failing school due to preoccupation with sex, recreational drug use, and just various other issues that we see in the short term. Some of the long-term effects of this include sexual dysfunction, legal trouble due to compulsive sexual behavior or sex crimes like rape or pedophilia, financial trouble due to paying for sex workers or attending strip clubs, not mentioned in this, but also paying for pornography or financial trouble due to the legal troubles that you're having with having this addiction. Injury or death due to dangerous sexual acts or sex while too intoxicated, autoerotic asphyxiation, or using inappropriate or dangerous objects during sex acts, as well as pregnancy and, of course, major STDs such as HIV or AIDS that are incurable. So some treatment options for this, because there is hope for sexual addicts. One of the major ones is medication, which is especially helpful for those who have compulsive sexual behavior that's associated with personality disorder, such as bipolar disorder. Because, as mentioned in the textbook, manic episodes that are caused by bipolar disorder have like a symptom of this is a lot of high self-esteem, which can increase people's likelihood of having compulsive sexual behavior, especially during the manic period of uh, their bipolar um, personality disorder. So treating that and being able to actually medicate for that and having people take their medications as they should for that can actually decrease the level of compulsive sexual behavior you have. And then another thing we see when it comes to medication is that for people with ADHD who take stimulants, certain stimulants actually are linked to causing compulsive sexual behavior in different individuals. And so sometimes stopping those stimulants for people who are ADHD or switching to different stimulants can actually be an effective way to treat a sexual addiction. Another treatment option, which is incredibly helpful, is counseling and therapy. Is proven to be a very helpful option for many, and this is especially true of those who have a history of abuse, which might be one of the leading factors in their compulsive sexual behavior. As I mentioned, a lot of people with compulsive sexual behavior have a history of abuse, and that can be helpful towards stopping that. Another treatment option, specifically for a specific type of therapy, is EMDR, which has been incredibly helpful in the process of recovering from a sexual addiction. But it is important to note that treatment facilities dealing with sexual addictions should also be prepared to treat co-occurring disorders, as I mentioned, like the bipolar disorder, as well as the ability to help patients suffering with SUDs, as a lot of the time these are co-occurring. There are not many places that offer this, but there are some in my area, such as the ranch, that can accommodate these type of individuals. Another interesting thing that we have seen in some of the clinical studies done more recently is that in a 12-meeting program, they came to the conclusion that research suggests effective treatment options could encourage the person receiving the treatment to direct their mental energy to changing their behavior rather than grappling with unwanted thoughts. So basically, redirecting thoughts rather than trying to put the brakes on them can actually help people basically avoid becoming entangled in a shame spiral, which will compound on your sexual addiction. So the success rate of treating sexual addictions shows that 9% of sexual addicts had completed an inpatient program for compulsive sexual behavior. 79% of married individuals were actively attending sex addiction support meetings. 91% of sex addicts and their partners had engaged in therapy with a counselor, and the average recovery time was 4 years, with recovery time ranging between 2 months to 14 years. For those who engage seriously in treatment, about 1/3 will reach 5+ years of sobriety, whereas 2/3 will stay within various stages of recovery, usually being sober for multiple years with occasional relapses. Now, the good thing that we have when it comes to this issue of relapsing is that about 60% of those who have achieved long-term sobriety report having relapsed at least once in the recovery process. So one relapse or two relapses or multiple relapses doesn't necessarily mean that you will fail when it comes to long-term sobriety. So some of the largest success factors we see in the recovery process are family support, peer support, partner involvement, accountability, and taking it as a daily commitment. So overall, there is a lot of hope for those who are caught in a sexual addiction, and that's why it's important that we bring a lot of support to them. So these are my references. I hope everybody enjoyed this. I really enjoyed talking about this, and I hope that this has helped some people.